In the 1970s, medical malpractice insurance was not readily available to medical professionals in Wisconsin. Legislators, the governor, and doctors across the Badger State recognized the serious implications resulting from a lack of insurance liability coverage. They took action. Responding with great resolve, the state created the Injured Patients and Families Compensation Fund. The Injured Patients and Families Compensation Fund was created in 1975 to pay medical liability claims that exceed the primary layer of malpractice insurance coverage Wisconsin healthcare professionals are required to maintain by law. Most Wisconsin physicians, some certified registered nurse anesthetists, hospitals, some nursing homes, and a few other healthcare providers are required to participate in the fund. Healthcare professionals are required to have their own primary layer of medical malpractice insurance coverage, and they must pay an annual assessment to the fund. There are no taxpayer dollars in the fund. For almost 3 decades, the Injured Patients and Families Compensation Fund was a model of good public policy as the state and medical professionals work cooperatively in the public interest.
Well, a lot of states don't have this sort of fund, and without this fund, malpractice insurance rates have climbed to the point where physicians have had to leave practices. Here in our practice, we recruited 2 gynecologists from Pennsylvania who could no longer afford their 6-digit malpractice insurance coverage. They actually came to Wisconsin so they could practice high-quality medicine and not have to have the exorbitant costs needed to protect their patients. In small towns, we have a lot of uninsured and underinsured, such as our dairy farmers. We have about 60% Medicare and Medicaid. These patients have very limited funds to pay for their office visits. Whenever the governor has raided this fund and it costs us more to replenish the money that was taken, money that was purely paid into by physicians in the first place, this raises office costs. This limits access to care because these patients cannot afford to see us and get the care they need. It makes it very frightening for a young physician to want to enter a state where there's an unknown overhead of malpractice insurance. Many physicians are leaving medical school with 6 digits debt, and to then have this unknown expense of rising malpractice costs hinders them and makes them look for other states that have a more stable environment.
The Injured Patients and Families Compensation Fund became a vital component in making Wisconsin a national leader in quality health care. Then, the state made a fateful and disturbing decision.
In 2007, the state faced a huge budget deficit that required tough decision-making and some choices that the legislators and the governor had to make. Unfortunately, they chose exactly the wrong direction to go, a short-term fix that takes money out of a fund for patients and their families, and that taking will likely prove unconstitutional and illegal. Where the Capitol could not do the right thing, we are asking the court to right that wrong.
With no recourse and the fate of injured patients and families at stake, the Wisconsin Medical Society took action.
The Wisconsin Medical Society filed a lawsuit against the state to make sure that the money that was taken is returned to injured patients. It wasn't the state's money to take. It was money that was put into the fund by physicians for patients.
I am Dr. Stephen Bergen at the Aspirus Weston Clinic. I am very sad to say that your Injured Patients and Families Compensation Fund is in serious jeopardy. Because sometimes a patient is accidentally injured, Wisconsin's doctors have provided the money and have taken the time to protect your Injured Patients and Families Compensation Fund. The fund provides for unlimited medical care, future financial stability, and social comfort for Wisconsin's injured patients and families. Tragically, $200 million have been raided from the fund, placing its future financial stability and its continued existence into question. Do you want to jeopardize a key component of Wisconsin's excellent healthcare system? Or do you want the peace of mind in knowing your Injured Patients and Families Compensation Fund will be there for you should you need it?
In December 2008, Dane County Circuit Court Judge Michael Nowakowski issued a decision that would allow the state to retain the money it took from the Injured Patients and Families Compensation Fund. Because of its unwavering commitment to protecting the fund, the Society has appealed the Circuit Court decision. The appeal is an important step in restoring the integrity of the fund. The Wisconsin Medical Society and its member physicians are working together to keep the care in healthcare by protecting patients and their families.